Hello, good morning, good afternoon, and good evening wherever you are. My name is Alfred Amuzu, and this is the Ghana Agenda for 27th February 2021. We are taking a short break this week, but I don't want to leave you without anything, so I'm bringing you two quick topics that are relevant for the week. Of course, we know court is on recess and to return on March 4th for judgment, and so we are keenly waiting for that. And we'll be bringing you what happens when court returns on March 4th. But you are also aware that recently Ghana happens to be the first country in the sub-Saharan West Africa or West Africa region to have received vaccines under the Covax scheme. And we congratulate the government for their efforts in actually making that happen. Now, we know that the Covax scheme is only going to provide vaccines for 20% of Ghana's population, and for all the other countries that they will be assisting, the countries themselves provide the rest, which is the 80% of the population will be covered under any other vaccines that the government decides to acquire. Now, what we received the other day was actually 600 doses of the coronavirus vaccine, which is the one produced by AstraZeneca. This is the 2 shots vaccine, so in other words, we expect at least 300,000 people to be inoculated with the first batch of these vaccines. Now, what that means is we expect the frontline workers, who are the nurses, the doctors, to be the first to. Now, as of mid-February, Ghana has recorded about 80,000 positive coronavirus patients, and out of that, 582 or so died so far, which is, really encouraging. But what you also see is that because of the lack of reporting and the inaccuracies in the numbers, other agencies are actually estimating the number of deaths using a comparative death record from prior years. So for instance, if you had 100,000 people dying in 2019 and now 20,000 people die in 2020, something has to be the cause. So the numbers we see reported could actually be an understatement of the issue. But now, as far as acquiring vaccines for 80% of the population, that will not be covered under Covax. So far, the government hasn't made any specific pronouncement on their plan to acquire additional vaccines. We are also aware that countries like Russia and China have developed their own versions of the vaccine, and that it may be possible that the Ghanaian government would receive some assistance from those countries, and those vaccines will also be made available to our people. But as we get to have that information, or as something develops in that area, we will bring that to your attention. But we just want to recognize the fact that the government of Ghana did very well to be the first country to have the arrangements put in place, and the logistics and all the paperwork and the things that goes with this scheme and how these vaccines are dispersed, to be the first to receive these vaccines in West Africa. We are grateful for that. Now, what this means is that, of course, the second wave, which Ghana is currently going through, would be assisted by the vaccines that just came in, since, of course, the frontline workers, who are the ones being most impacted, would actually now get some relief from the inoculations from the vaccination. Now, around the world, and we also know that when the president Donald Trump was in office, that he was not in support of the WHO, so there was not much support from the United States. There was no funding towards the Covax scheme. But now that we have a new president in the United States, in person of Joe Biden, who is in support of the WHO, that we expect additional funding to the WHO, and perhaps the 20% limit would be lifted up, and that countries like ours would get more vaccinations through that process. Now, we also are aware that the AstraZeneca vaccine, that it doesn't require the temperature limit that you would expect of the Pfizer ones, which require some negative 70 degrees or negative 30 degrees or so. And we know how Ghana's temperature, or the temperature in Ghana, and we know that can be very hot. So We also understand that the AstraZeneca vaccine, it's going to probably be the best for us in Ghana. Now, around the world and around the globe, we've seen, especially in the United States, that 50% of the population has so far been inoculated. And what that means is that the number of hospitalizations have reduced, and we are also seeing that reduction could, as explained by a few researchers, one from Colombia, we know that reduction is being spurred on by things like, one, that the vaccine it's working, and therefore people are getting the immunities they needed, and also that people who have already been infected have already gained some type of immunity, and helping the spread of the disease, and therefore the decline in the hospitalization and in the death rates that we have seen. So it's all looking good, and we think that hopefully by there are predictions out there that hopefully by June of 2021 that things will begin to return to normal in the United States. So we are optimistic about that. Now, we also expect to keep our mask on in the United States at least until sometime in 2022 before the mask can come off. But in the meantime, we are seeing positive signals or positive signs in the numbers of hospitalizations, infections, and also deaths. Now, this could be spurred on even more, or this could even be more pronounced as the vaccines continue to be rolled out in significant numbers across the world. We are also expecting that countries like United States and other places like Israel, UK, Spain, Italy would reach herd immunity perhaps before the end of the year. And what that means is whether it's going to be 75% or 80%, as even researchers disagree on the number of inoculations or the number of people who need to be exposed to the vaccines in order to the vaccine or to the disease in order to reach herd immunity. So with all that said, these are positive developments, and we will keep an eye and bring this to you as time goes on. The next thing I wanted to talk about is the G5 Sahel countries. We're talking about Burkina Faso, Chad, Mali, Mauritania, and Niger. Around the border of Burkina Faso, Mali, and Niger, we know there are several militants operating in those areas, and a few of them that I have here would be, of course, the Islamic State in the Greater Sahara, the Front de Libération du Messina. We also have the Ansar Dine, and so on and so forth. Of course, in Nigeria, we have the Boko Haram and then the Ansar al-Islam. So these are some of the, the Islamic militants operating in those areas, and we are hoping that the French, who are currently assisting with 5,100 troops, will continue to keep their troops there, even though I know Emmanuel Macron is about to go through another re-election, and there could be pressure at home to draw down on the troops in Africa, who some are dying out of these militant actions, and that is now looking well for the French population, as they think their troops should be home versus fighting to secure countries in Africa who are not necessarily French citizens. So it brings the question to mind: why is ECOWAS not leading these fights, knowing well that ECOWAS has a military arm, which of course was used in conflicts like the ones we saw in Liberia in the 1990s. To the extent that we are bringing in foreign nations like France, Netherlands, and all these other countries to assist, and we know the implications of them coming to assist, because most of the time through this conflict that the foreign forces sometimes get to destabilize other neighboring countries, or even countries in which the conflicts are occurring, and install governments that are sympathetic to their cause. And so some of these things are things we need to watch out for. And I'm saying this because our president, Nana Akufo-Addo, is the current chairperson of ECOWAS, and perhaps that's their conversation at the executive level to tame these Islamic activities within the sub-region using forces from the ECOWAS countries or under the ECOMOC umbrella. Now, with that said, I still want to congratulate the government of Ghana for being the first country to acquire the Covax medicine or the Covax vaccine for Ghana. And I look forward to, of course, having our frontliners get some relief from these vaccines and being able to continue to provide services for the infected and the morbid population in Ghana. With that, I say thanks for watching Ghana Agenda. We come every Sunday on ACO Radio, YouTube, Facebook. Tell a friend to tell a friend if you haven't already done so. My name is Alfred Amuzu. Thanks for watching. See you next week. Bye.